Aging-associated changes make skin vulnerable to several conditions, primarily dry skin. The purpose of this video is to provide important information to the elderly client related to teaching assessment skin techniques and to help the client and caregiver with adequate information to improve the client's skin condition. These are the following objectives. Teach the older adult how to assess his/her skin appropriately. Teach the older adult the importance of a healthy diet in order to promote healthy skin. Teach the older adult and family members how lifestyle can affect the skin of the elderly. Instruct the primary caregiver how to provide skin care in the older adult with disabilities.
Hello, Mr. Wilfredo. How are you?
How are you doing? Good.
Hi, I'm Susana, your nurse practitioner.
Oh, thanks.
Please, can you sit down?
Thank you.
Tell me, how can I help you?
Oh, I got that itchy on my back and on the back of my arms. It's turning me crazy.
Oh, that must be very uncomfortable.
Oh, yes, it is.
Something? Do you check your skin frequently?
No, not really.
Oh, you know that's very important. You have to screen your skin to see if you have new lesions or all lesions have changed.
I cannot even see what it is.
Do you have a mirror in your house?
Yeah, yes, I do. I need a mirror?
Yes, you need a mirror to check your skin. I will show you how to do it.
Oh, thank you. Thank you.
Okay.
You got that for me?
Yes, I will.
Thank you.
Look at the front and back of your body. Then look at the sides with your arms raised. Also look at your forearms, the back of your arms, and your shoulders. With the hand mirror, check the back of your neck and your scalp by parting and lifting your hair. Don't forget to check your hands and feet, and also between your fingers and toes.
Did you understand how to screen your skin with the mirror?
Oh, yes, yes.
Sure?
Yes.
Can you show me how to do it?
I can do it, but maybe I need some help.
Okay, let's go.
Okay.
Checking your skin means taking note of all the spots on your body, like moles, freckles, and age spots. Also, if you see a mole or skin lesion that looks different from the rest, or is changing in size, shape, or color, or wounds that don't heal, bleeding or itching of lesions, tearing, redness, flaking, or secretions, you should have it checked by a dermatologist.
How do you describe your skin now?
Dry and itchy.
Oh, and you do something about that?
Yes, I eat a lot of fat to keep my skin oily.
Oh, you know that eating a lot of fat is dangerous for your health.
Oh, yes?
Yes, and you won't get your skin better or oilier. So I will recommend you to eat a healthy diet for your skin and for your overall health. Do you like fruits?
Oh, I love food.
So you have
fruit.
to eat a lot of fruits and a lot of vegetables. Berries, do you like berries?
I love it.
Blueberries and green leafy vegetables like spinach are very good. Remember not to eat too much meat. It's better if you eat fish. And dairy products, but low fat or non-fat.
Okay, thank you. What else I can do for my skin? Just eat?
No, there are a lot of things you can do for your skin. Mr. Wilfredo, allow me to explain you the importance of protecting your skin. Excessive sun exposure can cause dryness, dark spots, abnormal wrinkles, and even skin cancer. This is very important to consider since you spend a lot of hours gardening. The areas of your body that are exposed to the sun, such as your hands and your forearms, age more rapidly than areas normally covered, such as abdomen and buttocks.
To protect your skin, you should generously apply a broad-spectrum water-resistant sunscreen with a sun protection factor (SPF) at least 30 to all exposed skin at least 20 minutes before going to the sun. Wear protective clothing such as long-sleeve shirts, pants, a wide-brimmed hat, and sunglasses where possible. Reapply approximately every 2 hours, even on cloudy days and after swimming or sweating. Broad spectrum provides protection from both ultraviolet A, UVA, and ultraviolet B, UVB rays. Seek shade when appropriate, remembering that the sun's rays are strongest between 10 a.m. and 4 p.m. If your shadow is shorter than you are, seek shade.
Do you smoke?
Yes, it is. I smoke.
You know that smoking is very dangerous for your health.
Oh, yes?
Yes, and it also will age your skin very rapidly because smoking deprives oxygen from your skin.
Oh, okay.
Good morning.
Good morning.
Good morning, Mrs. Gonzalez. How are you?
I'm fine, thanks.
How's your
for
father
asking.
doing today?
Well, I'm a little bit concerned about him because he has been complaining of skin irritation lately.
And what have you been doing about this? How do you take care of his skin?
Well, I bathe him every day,
Okay.
and set the water more hot than warm.
Okay.
Because hot is better to take the germs away. After that, I applied a lot of antibacterial soap and scrubbed his skin. And after that, I dry him up, and then that's all. That's what I have. I don't know why his skin is like that, because I provide him a lot of care.
I understand. Well, I will orient you and show you important facts to take care of his skin so you can help him improving his skin condition. Okay?
I will appreciate that.
It's okay.
Thank you.
First, let me see his skin.
Okay.
Okay? Let me see.
Can I help you?
I can see that his skin is very thin and that he has been scratching himself frequently. Have you been scratching yourself frequently?
Yeah, I got a lot of itching.
It itches a lot.
Yes.
Okay, this is sign of dry skin. Would you like to come over and see?
Okay.
Look at his hand. This is sign of dry skin. Caring for older skin means basically to prevent dryness, replace lost moisture, and protect from damage. Hot water and soap-based products cause unnecessary skin drying. Water also dries skin, so it is important to limit its use. I suggest you give rapid baths. 1 a day or every 2 days, if weather permits, may be enough. Do not use hot water. The temperature should be between 95 and 106.5 degrees Fahrenheit to prevent burns. You can get a thermometer to reduce this risk and control water temperature. Avoid excessive soap, and you can buy soap substitutes or skin cleansers, which are good to use for delicate skin. Be careful when drying his skin because it is vulnerable to bruises, break down, and get infected. Don't forget to dry between his fingers and toes. I recommend that you apply moisturizer lotion after bathing him and maybe even twice a day.
I understand what you're saying, but how can I apply the moisturizer?
Moisturizers can be either lotions or creams, and some patients have their own preferences. So in his case, it would be nice if you can offer him both so he can choose which one he wants to use. It all depends on the consistency. Some older adults prefer cream because they're thicker, they're oilier, and makes them feel better. Also, older patients have issues with the fragrance that a moisturizer can have. So if it's fragrance-free, it would be better for him. There's also another thing I want to mention. Apply the moisturizer after you shower or bathe him, and also on generous amounts. but be aware that he can fall because putting on a moisturizer, either lotion or cream, makes the surface being more slippery, so he may fall. So you have to be aware of that. Okay?
Thank you very much.
Do you feel comfortable with all the explanation I gave to you?
Yeah, thank you very much. And realized that I was so wrong. I will implementing this in as soon as I can, as soon as possible.
All right. Okay, you're welcome.
Thank you.
You can always call if you need help, okay?
Thank you very much.
Okay.
Thank you.
Skincare in the elderly includes healthy diet, sun protection, and frequent applications of emollients to their skin. A healthy skin will prevent pruritus, scratching, and breakage of skin with consequent skin infections. Safety measures are required to avoid falls due to slippery skin and surfaces. In this presentation, we reviewed the importance and technique for the older adult to screen his skin, the importance of a healthy diet, the reason to protect the skin from the sun and guidelines, and skincare measures for caregivers on how to maintain a healthy skin in the elderly. The learner should have acquired valuable information about skincare in the elderly.